The tests I'm about to demonstrate are for the spinal cord and meningitis. First, I'm going to demonstrate hermit sign. So I'm going to have you bend your shin down to your chest. Okay, you can relax down. The positives will be electric shock-like sensations down the spine and through extremities, and indicates dural irritation or spinal cord injury, spinal cord inflammation or compression due to degeneration or canal stenosis. I'm gonna do this. This would be the Koenig sign. Perfect. The positive would be inability to fully extend the leg and or pain usually in the neck region, indicating meningitis or meningeal irritation. So for this key sign, I'm going to have you place your shin to your chest, laying down. Okay, perfect, thank you. Positive would be involuntary knee flexion, indicates meningeal irritation or nerve root lesion. I will now perform tests for the structure of the cervical spine. First off, we have the Soto Hall. I'm going to have you spread your boobs for me, please. I'm going to place my hand in between. And now I'm going to flex your cervical. Perfect. Positive would be generalized pain in the cervical region, which may extend down to the level of T2. Indicates non-specific test for structural integrity of cervical region. I'm going to be performing the Valsalva maneuver. I'm going to have you seated, please. You're now going to reach forward and compress like you're having a bowel movement. Okay? Positive would be radiating pain from site of lesion, indicates nerve root entrapment by a disc lesion. Now we'll demonstrate tests for foraminal encroachment. Cervical foraminal compression. I'm going to have you look forward, please. And now I'm going to compress down. Look this way. And the other way. Okay, this one has two positive indications. Positive would be exacerbation of localized cervical pain, indicating foraminal encroachment or pathology without nerve root compression. And positive would be exacerbation of cervical pain with radicular component, indicating foraminal encroachment or pathology with nerve root compression. I will now demonstrate tests for thoracic outlet syndrome. First, we got Adson's test. I'm going to have your arm and put it to the side and place down. Get the radial pulse. And now can you look at me? And put your shin up. Perfect. Thank you. Positive would be pain or paresthesia, decreased or absent pulse in amplitude or parlor, compression of the neurovascular bundle or biscalenius adipose or cervical root. Now sit up straight. Can you sit erect? Like that. It can be one hand only. And now I'm gonna have you place your shoulders back. And now I'm gonna have your shin to the chest and hold your breath. Okay? Positive would be pain and or paresthesia, decreased or absence, pulse amplitude, and parlor. Compression indicates compression of the neurovascular bundle between the clavicle and the first rib. I'm gonna perform the hyperabduction maneuver, aka right test. I'm gonna get your radial pulse, okay? Just relax. And I'm gonna AV duct, fully AV duct, and hyperabduct. Okay. Positive would be pain and or paresthesia, decreased or absence, pulse amplitude, parlor. Indicates compression of the axillary artery pectoralis minor, or coracoid process, thoracic outlet syndrome. Now I'll demonstrate tests for the ulnar nerve. Okay, I'm gonna have your arm like this, and now relax your arm. Let me do the best. Okay, positive would be pain and or tenderness at the site being tapped, and paresthesia in the ulnar nerve distribution area indicates neuroma of the ulnar nerve. Now we're gonna perform the Froment paper sign. Can you do like that? And now can you hold the paper? And don't let me take the paper away. Perfect, thank you. Positive would be the patient is seen to flex the thumb, thereby recurring the median nerve to compensate for apparent weakness, indicates ulnar paralysis due to weakness of the ulnar nerve innervation muscle. Now I will demonstrate tests for median nerve entrapment. First we're going to do the Fallon sign. So can you do this? Perfect. Now we're going to do the prayer sign. Can you do this? Perfect. Positive would be reproduction of pain and or paresthesia in the median nerve distribution area, indicates median neuritis or carpal tunnel syndrome. Now we're going to do the tunnel wrist sign. Okay, can you do this? Okay, now relax. Perfect. And positive would be reproduction of pain, tenderness, and or paresthesia in the median nerve distribution area, indicates median neuritis or carpal tunnel syndrome. I will demonstrate tests for thoracic nerves. So now we're going to perform the Adam sign. So can you please put your hands like this and touch your toes. Okay, now we're going to notice her scoliosis curvature. It kind of leans to the right side. Positive would be an scoliosis is observed to straighten, indicating negative evidence of a functional scoliosis trauma or subluxation. Second one would be an scoliosis does not straighten, indicates positive evidence of structural scoliosis. Can you cross your arms for me and do a sit-up for me? Thank you. Positive would be superior or inferior movement of the umbilicus, indicates superior movement of the umbilicus is indicative of a spinal cord lesion at the level of T11 or 12 or lower abdominal weakness. Inferior movement of the umbilicus is indicative of nerve root involvement T7 through T10. Can you go ahead and put your arms like this? And now can you turn to the side? Thank you. Positive is pain on the concave side or convex side, indicates pain on the concave side indicates intercostal neuritis, while pain on the convex side indicates fibrous inflammation of the pleura.